Hi guys, I'm Sanjana Salunke, beauty editor at Grazia India, and I'm conducting a very special session today with some of the best names in the skincare industry. Now, Tweakments as a concept has been gaining ground in the age of the new coronavirus. At least the curiosity around them is. The most popular reason being unflattering zoom angles or extra recovery time on hand. People are spending so much time looking at their faces that it has led to an increase in seeking out tweakments. With places opening up, if there is one place that currently has a waiting list, are definitely clinics for cosmetic treatments. So, who better than the pioneers from the skincare industry to deep dive into these treatments and the technological advancements in beauty? We get Dr. Jaishree, internationally renowned celebrity cosmetic dermatologist, founder of Skinfinity by Jaishree, author of Skin Rules and Skin Talks, who's going to be joining us today. We have Dr. Geetika Mittal Gupta, skin expert and aesthetic physician, also a founder of Isaac Lux and Skin by Dr. G. If you don't know, Skin by Dr. G has some amazing facial tools that you definitely must check out. And lastly, we have Dr. Kiran Sethi MD, skin and aesthetic specialist, founder of Isyaderm and author of Skin Sense. You might want to check the book out. Okay, so welcome Dr. Geetika, welcome Dr. Jaishree, and welcome Dr. Kiran. Very excited to have you on for this, and I'm so glad you guys could take the time out to be a part of this. It is one of the most important sessions for the Virtual Beauty Carnival, and also the one that we are really looking forward to. So let's get started. So first question is, I'm constantly talking about tweakments. I want to hear what is your take on the concept of tweakments or what the word means to you. We can start with Dr. Geetika.
So tweakments is in fact a very popular term that we are seeing popularize, and which is actually, if I have to simplify it, these are simple tweaks that you can do in your procedures at the right age so that you can avoid the most advanced ones. So this is like a stepping stone that is between, say, facial creams or a facial and a scalpel. So the area between both of these things is the treatments that you can start at the right time to bring about the subtle changes so that you can avoid those aggressive procedures later on. So treatments are small, subtle changes, in my opinion.
Okay. Anything you'd like to add, Dr. Jaishree?
I think she said it so beautifully, but I would just say that these are absolutely non-surgical lunchtime procedures that we do. And you have to, you can actually go and there's hardly any downtime. And it's always important to start early. We tend to think, especially in our country, that 45, 50 may treatment, we'll do a treatment at 50. That's not the thing. If you start early, you maintain that youthfulness and that glow, and you continue, you turn back the clock, you age gracefully, and yet you are youthful. So that's what it is all about.
How lovely. Dr. Kiran, I know you love the word tweakments, so I want to hear from you.
Oh, so tweakments, to me, tweakments is just like, you look like you, but you just add that extra pop, right? Like it's you, but maybe you're just a bit more lifted. Maybe your nose is just a touch more sharp. Maybe your eyes are just a bit more upward. It's the jaw is just that little bit of sharpness. I'm sure Jaishree and Geetika know when our certain clients come in that are on Instagram a lot, they're very particular about just that little tweak, because it just adds that little extra value without anyone realizing what's happening. So it's more of like you're tweaking, you're not really treating.
Right. Mm-hmm. Okay, now we all have seen how our relationship has changed with our skin in general because of COVID-19, right? We had so much time, we had so much focus on skincare. Even makeup now comes with skincare infused benefits. So I want to hear from each of you on, like you experience and you meet customers or clients on a day-to-day basis. So I want to hear it from you in terms of what kind of change are you seeing with consumers and their relationship with skin post-COVID. We'll start with you, Dr. Kiran.
Okay, great question. So before the pandemic and after the pandemic, there's a whole world of difference. All of a sudden, everybody wants a vitamin C, a retinol, a niacinamide. They want to know what beauty device. They want to know which gua sha they should buy. Dr. G has a great gua sha. They want to know everything, right? So they want to come to us and discuss all of this. And before the pandemic, it was more like, well, I feel a bit dull. But now it's like, which vitamin C serum do I buy? So the shift is tremendous. Everyone is active. Everyone knows what's happening. Everyone is aware. I would say while that's a positive, because now people understand the benefit of good skincare and the benefit of therapies that can happen and the things you can do at home and the things you can do with us, there is a downside as well, because in the search for the best vitamin C serum, you're losing on the search for actually making your skin healthier. In the search for anti-aging, you may actually be going a bit overboard at home and causing more irritation or increasing the risk of rosacea. So that it's always a rise and a fall. There's always a blast and a boom. The middle level has yet to come.
Right. What about you, Dr. Geetika?
So I would think that COVID has given a lot of time to everyone to not only read up, but also educate themselves about skin. They've started to take it more seriously. And I had been trying to educate everyone, talking about skin health as just not something which can be done with the help of cream or a quick treatment, but it is all inside out. And I think COVID has taught and educated all of them in a fashion where they're taking it more seriously and they're wanting to deep dive more and more, be it choosing the actives, be it using the tools at home, or also maybe when they're understanding the treatment suggested in a better fashion. Rather than straight away adjusting the features, they're looking at collagen remodeling more seriously, be it with microneedling or using ultrasound therapies. The idea is now to get that skin health glowing from inside out. I think people are now not in the mood of shortcuts. They want longer duration, long lasting results. But again, they don't have any, let's say, appetite for downtime, which is okay. But the technology is evolving. So we are able to cater to that set as well at the same time. So there is a shift, and I'm enjoying talking to my patients even more every day because they are becoming more and more knowledgeable. So the idea to interact with them becomes even better because they understand what we are talking about. Now they understand the 2-finger, 3-finger rule of sunblock instead of us blabbering all the time and them saying, okay, doctor is just going to tell us about sunblock. So for us to educate them is easier. But having said so, there's also the experimentation that goes on with all the the OTC products, having all the actives lined up. So people are making their own labs at home, mixing things and applying and coming to us when all things just go bad. So it's important to understand your skin type also. So there are all types of patients, but definitely there's an evolution and a shift I see where patients are more ready to invest in for long-term beauty and not just look at short-term treatments for quick results.
Right. What about you, Dr. Jaishree?
I think both my colleagues have so beautifully put it that I have nothing to say. But there is definitely an urge for a no makeup natural look these days. People want that, and they are so aware, as Dr. Geetika rightly said, that everything is out there. They are well read now. There are bunch of influencers who have also put it out there. So people come to you with a lot of products, and in fact in the clinic they end up coming with this, and sometimes it's the downside is that, whoa, I mean, you don't really need 10 layers and you don't really need so many actives, and probably I have to confess here that I have seen more side effects post the lockdown happening to people than before, because they've tried their own peel, they've tried derma roller at home, or they've used so many different actives, mixed and matched things that should not be matched. So yes, on one side, there is beautiful awareness. People at least now know that there is a vitamin C and a retinol, and that skincare is actually essential, and you can't just, neglect your skin. But at the same time, the downside is that there is too much information and people are not, it's not being put together well. So you have to actually put it well and put it across well, and from the right kind of people who have actually studied for 8 to 9 long years. Just yesterday, we put up a thing, the IADVL, the Association of Dermatology, put up a post on Instagram saying it takes 9 years for us to become a dermatologist. So, it's not easy. And the study goes on. I mean, I was just talking about going for, to the AAD, which is the American Academy of Dermatology conference. And we are constantly reading, all of us. So it's very important to respect the skin, and good to know, good to have that knowledge, but use it the right way, at least once, consult with a dermatologist.
Right. Actually, I'm going to come to the thing that you mentioned about how people are doing so much more DIY at home because they had so much time on hand, right? Can you help us explain or elaborate a little more on doing these treatments at home versus getting it done at your clinic, and why you should prefer an expert help over testing and trying at home? I would like you to lead this, Dr. Jaishree.
Oh, okay. So, there are some things which you could do at home, right? From basic skincare and, using the right kind of serums and stuff. Yes, go ahead. There are some amazing facial packs, home kit facial packs. One of my friends, Dr. Chaitra, has one. Dr. Geetika, I'm sure you have some stuff. You can use those things, but you can't go overboard and buy like a 30% glycolic acid and start using it. You will burn your skin. I had a person who developed scars, right? There is so much science behind it. You can't, the skin has many layers, and you have the epidermis, you have the dermis, you have, and it can burn like this. It can scar. And then to treat that scar, it will take us months, right? So it's very essential. Then you talk of derma rollers. Everybody's buying derma rollers and using them at home. What about infection? How are you storing it? Are you using that same thing? I know of a person who's constantly using the same derma roller, maybe, I don't know for how long. So the needles will get blunt. Okay, there's a very high chance of infection. You are activating folliculitis, acne, and all these things. There may be hyperpigmentation. So you've got to be very, very careful, when it comes to these devices. People are using, I have nothing against facial exercises. They're great, but sometimes you overdo them. Please understand that these are muscles. So when you're overdoing your muscle here, this is really bulking up. So suddenly your face has from an oval face, it's become a square face because your masseter has bulked. Or you develop more frown lines because of all those. Of course, they're also developing frown lines because constantly looking at the laptop and the cell phone, etc. So we're over activating the muscles here called the corrugators and the procerus and the corrugators. So you develop those frown lines. But when you're doing certain facial exercises, you're also developing those frown lines. So you have to do the right kind of exercises. So right from using tools, where there's a lot of, infection and stuff that can happen at home. You must come for certain treatments. You must go to a dermatologist because we maintain asepsis. We make sure, we have our all the gadgets. Everything is, completely sterile. We treat every non-surgical procedure like a surgical procedure when it comes to cleansing and stuff. And skin, you can, all kinds of bacteria and yeasts and everything can get in. It can penetrate. So you got to be very careful. The right depth of penetration of a peel or a micro, the needle is also very important. You won't know how to do it at home. Instead of 4 minutes, if you leave it for 6 minutes, you'll burn the skin. Right? So even in the clinic, I don't allow a therapist to sit and do a stronger peel, maybe a milder peel like an Ormedic or an RG, they're just very superficial party peels, maybe a therapist can do. But if it's a medium depth peel, which people are actually easily buying over the counter, no, you have to understand, you have to do the right kind of degreasing. You have to do the right kind of, procedure before and after. So that is very important.
I agree. I completely agree. Okay, my next question is for you, Dr. Kiran. I want to know, what are some of the most common tweakments that people are getting at your place?
Oh, okay. So actually one of my favorite tweakments is something that is preventative, which is skin boosters. So it's a wonderful, it's my favorite. Dr.
Mine too.
It's so good. It's preventative.
I love it.
Yeah. And it just gives you this great natural lift. You look more supple, you look more fresh. It makes you get, that dewy effect if you use the more superficial ones. The deeper ones are just more elasticity. It's fabulous. It's actually one of my most favorite and very popular. Another one actually would be just a touch of, but obviously usually your Botox and fillers, but I like to do them, and I'm sure my colleagues also agree, in a way that you still look like you, as opposed to just filling you up like a pillow. I want people to look like them, and most of them want the same. So it's a tweak, and it's done slowly. I take my time. I like it. It's an aesthetic process. It's creative, and I love the creativity of just allowing someone to express themselves with a tweak. And threads are great. The brows, which you can do with the thread, which you can do on the jawline, they're fabulous. And then all our little procedures on top, which help make the skin more smooth and that lovely makeup-free look. They're great. I actually talk a lot about all the procedures that are available around India and abroad in my book, just as like a short breakdown at the last chapter, because it's just great for people to know what's available, what the side effects are, what the benefits are, what you can get, what you don't get. And you can go to anyone, any good doctor around there, which there are so many, and we're here also. So why not understand it and then not feel scared? Because there's really nothing much to be scared of.
Exactly. I think there is, but that
I want to add something here. So when Dr. Kiran said skin boosters, and I was also excited, and I could see the excitement in Dr. Geetika's eyes as well, because we all love skin boosters. A lot of times people misunderstand this term, and the moment we say injections, they feel it's fillers. So please, guys, understand that, these are not fillers. Okay. Yes, they are hyaluronic acid made in a way that they will boost your collagen. They will stimulate the fibroblasts, which are cells which produce collagen. So you have new collagen formation. And at the same time, hyaluronic acid hydrates the skin. So which is why they give you that dewy look, that added glow, that amazing youthful look on your face. And so they are not fillers. So that's something that people need to understand. And don't be scared, as Dr. Kiran said, and start early.
Yeah. And in fact,
I do that to myself.
I like the way you said, Kiran, that I don't want to puff them like a pillow. And when it comes to skin boosters, I generally tell my patients, take them as injectable moisturizers. Yeah. So that's all that they're going to do, So
that's exactly what they are. They are moisturizers, they are injectable moisturizers, and they do well. People with very dry, sensitive skin, like overnight, they feel so much better, And so that's how it is. And the other thing that you said, that it's an art. When we're talking about fillers, we are also sculptors and artists. So it's an amalgamation of science and art. And so you have to do it slowly. You can't do 10 syringes on one day and create that, or have the lips come, enter the room before the face enters. It has to be, so it's so very important to do it the right way and understand that art.
So now, like all three of you mentioned, how they are extremely safe, easy to use, and they are like injectable moisturizers, the word that I'm going to take away from Dr. Geetika. But there is still a lot of worry associated. Like every time you talk about any treatments, like, oh, you're injecting my face. Oh, there is always that cloud that's, like hovering over you. So I want all three of you actually to talk about the pros and cons of these treatments, and if one was to consider it, then whether they should go for it, not go for it.
See, I think there are many pros. The first thing is that there are no side effects, apart from the fact that you may bruise, and if you bruise, it's very rare though. I mean, we do ask our patients to stop omega-3 and vitamin E and ginkgo biloba, something called NSAIDs. These are painkillers like Combiflam. So you stop those about 3 to 4 days before you want to come, and don't have green tea. Green tea. Yeah, I said green tea.
That's a big one.
Oh, you cannot have green tea, is it?
Yeah, you cannot have green tea because it's a blood thinner, and you don't want the blood to be thin, because the moment you put a needle in there, you don't want it to flow. So you ask your patients, ask the people to stop these things about 3 to 4 days in advance. and then come for the treatment. And then, you may give them arnica, you may ask them to have a lot of pineapple because that's got bromelain in it. You also get bromelain supplements, which help to, prevent easy flow of blood and sort of help in clotting. So you do all that, and then you do these injections, and you can't even see them, you rarely have a bruise. So, and if you have a bruise, if at all, then it goes off in about 4 to 5 days. So first, number one, it's a lunchtime procedure. There are no side effects. There's no downtime. There's no hospitalization. There's no anesthesia. You're not waste, and it's also cost effective. Let's understand that, right? And it's doing great. It's penetrating, as Geetika said, it's an injectable moisturizer. So if you have dry skin, flaky skin, sensitive skin, rosacea, and your creams are just not helping you, this is the way forward. So you can do when it comes to boosters. When it comes to treatments like fillers and threads and stuff like that, instantly you sort of look more youthful. I won't say younger by 10 years because that's not our aim anymore. We're not aiming at we want to make you look maybe 5 years younger.
A better version of yourself.
A better version of yourself. Enhance your own features. Don't make yourself look like somebody else, and do those little tweakments here and there, and just go back feeling confident and happy. So that's the beauty. And the cons are that they are not permanent treatments. So, something may last for a year, some treatments may last for 6 months. If they are things like a peel, then you might have to do it you might have to do a couple of sessions. Lasers, you'll have to do a couple of sessions. You don't get an instant, your hyperpigmentation is not going to go off with one laser session. You need a couple of them. So I think that's the only con. I really don't see, unless you have, allowed the whole foundation to break, you haven't taken care of your skin. So the building has fallen. And then you have to rebuild. You have sagging skin. You have really bad jowls, and you have bad under eye bags. You can't do anything non-surgical. Then you have to go for a surgery, right? Mm-hmm. So yeah. So otherwise, I think treatments are absolutely beautiful, amazing for every age group. I would say start at 22 to 25. Is what I would do, very little things. And then I would, and I would definitely tell people, please do not wait till you're 50.
Yeah. Then it's not a treatment anymore.
It's not a treatment anymore.
It's a treatment.
Sorry?
I said, then it's a treatment. No more tweaks.
Yeah.
Dr. Geetika, I would actually love for you to elaborate on, like Dr. Jaishree mentioned, she would recommend anyone between 20 to 25 to start off with these treatments. If you could just add to that a little.
Absolutely. So I would suggest Tweakments, as the word is, small tweaks or just a step up would be essentially done when you are in your, say, 25 or late 20s, because your collagen is also nice. That is the right time when you can do these prejuvenation treatments. They're like not rejuvenation, but prejuvenation. You can do the baby Botox, you can do the skin boosters, you can start with skin remodeling collagen treatments. You can do all of that, and that will maintain the skin and the youthfulness longer. Vis-a-vis, if you come down later, then it is going to be more invasive. You would need more filler. You would need a proper Botox sitting rather than just doing those microtox injections, because your body can take it, and those will be like subtle changes. You will maintain the look. Like in my clinic, I'm not a big proponent of people changing their looks overnight. That is just not done. It is just that youthfulness, that softness that should be maintained. You don't want to look like every other woman on the road. So you have to maintain and do it in a process, aesthetically, softly, subtly. But yeah, having said so, there are also people who are getting a lot into preventative Botox. I would say that it is good, but let the expressions form a little bit. We are expressive human beings. We use our expressions to talk to each other and express. So it's important, and everyone expresses differently. Some people have more deeper crow's feet because they smile a lot. Some people have more deeper frowns because they tend to read like that. So it's important to have some expressions and understand your expressive face and work on it essentially like that. Soften them, but maintain the expressions, because done other days, I think we have all learned better. No one wants those duck lips. No one wants those frozen looks. So it's important to choose the doctor well. It is important to start at the right time. And it is also important to continue softly and subtly to maintain it. And just don't give it up in the middle. Because skin is the largest organ of the body. And these treatments are also meant for people who are doing the essentials right at home. So if my patients are not doing their skincare well at home, which is the sunblock, retinol, vitamin C, based on their skin type, or not sleeping well or eating well, the treatments will also not be able to help you just so much. So those essentials definitely have to be taken care of.
I think what is really important is that this whole thing about skin has to be holistic.
Yeah.
So if you don't eat right, and if you're stressed constantly, and you do thousands of treatments, nothing is going to show. So that's something that has to be sent across to people. The other thing, when I talked about 22 to 25, that's not the time I would actually do injectables unless the person has really deep socket, hollow under eyes and is looking tired all the time. But I would do things like microneedling, which is like with a derma pen or a microneedling radio frequency, or I would do some peels for them, or I would say do a vampire facial. So these are things which I would restrict, between the age of 22 to 25, unless, as I said, under eye hollows or very thin lips, just sometimes doing that little tweakment and enhancing the lip is going to make a world of a difference to the person's face. So something as basic as that, but otherwise, injectables, boosters and all, I usually also start post 25.
And since you guys mentioned Botox, please go ahead.
So I actually would like to, I actually am very much in line with how Dr. Jaishree goes about it as well. In the early to mid 20s, I like it to keep it pretty non-invasive, peels, gentle facials. A good Hydra facial is so nice for that age group, right? PRP is fine, but microneedling, agreed, where we keep that collagen boosting. After the age of 25, collagen production actually seems to go down in net collagen production. So we want to keep boosting that. I like that. I like radio frequency, as time goes on in the late 20s, we start to see a little bit of that elasticity go down. I like that. I'm not personally a fan of preventative Botox. It's just me. I just don't.
No, I'm not a fan either, Kiran.
Absolutely.
I do not like preventative Botox. I don't believe in it. Exactly. Honestly, I don't believe in it.
But it's a personal choice. Everyone's different.
Yes.
I'm not for it.
And if that one forehead line is really nagging you, you can actually do a baby Botox instead to just sort of ease that line, not have you constantly looking at that line.
Yeah.
Don't make it disappear, but
expressions are important.
Yeah.
Also microneedling, laser resurfacing, radio frequency, so many different options.
These are amazing treatments. Yeah. Radio resurfacing is amazing. I mean,
we can treat it, we can prevent it. Yeah. Before I jump on to Botoxing young ladies, I'd like to do as much as I can before I have to go there. But it's a personal choice again, so.
No, I think I completely agree with you. And one thing I want to tell people is that Botox and fillers are not the same.
Right.
So when we say, a lot of times people are really confused and they think, it's all the same. No, we all here, I think, are more the filler people and the skin booster people. But we will also definitely do Botox if you need it after a particular age, but fillers are these pre-filled syringes of hyaluronic acid, which we inject into the skin, maybe, under the eyes or the lips, or if you, a little bit on the cheeks, or lifting your face if it's sort of coming down. So you just sort of give it on the sides to lift it, to create a nice jawline, or, if you have temple hollows, then you do that. So these are pre-filled and you sort of recontour the face, you just tweak and make your certain features look better, enhance yourself. Whereas Botox is a medicine. It's an injection which works on a muscle and relaxes the muscle. And therefore, you are unable to use that muscle for the rest of those 4 months. It only lasts for about 4 to 5 months, and then the effect wears off. So for example, if you give it here in the frown line, these two muscles which are here, which are constantly active, they're relaxed. They can't, they're not active for those 4 months. So then this gets stretched and these lines disappear. So that is Botox. Okay. So they are very, very different, two very extremely different things. Please understand that.
But they work together quite nicely too, right?
They are, I think skin treatments and tweakments have to be combined. You can't just do one treatment. You have to combine a couple, because somebody will have hyperpigmentation, uneven skin tone, acne scars, and at the same time have hollow eyes, dry skin. So you would want to do skin boosters for the dry skin. You would want to do, fillers for the under eye. You would want to do resurfacing laser for the scars. You want to do peels or a Q-switch Nd:YAG or a pico laser for the hyperpigmentation and the skin tone, uneven skin tone. So you have to combine everything and, give it as a nice package so that, you at the end result is really good. So that's another thing that people need to understand.
It has to be bespoke. It has to be customized. It cannot be.
It's always bespoke. Always bespoke.
They need hydration, skin might need something else.
I have a lot of people who come and say, what is your bridal package?
I know.
It doesn't work that way.
I hate that question.
Yeah,
what does that mean?
Yeah. So because every skin is different, even in terms of a cream that works beautifully for me may cause a lot of acne for you, so you can't say what is the package. No, every face is different.
When I moved here, so I'm originally born and raised in New York. And when I moved here and I first started working here, when people would ask me bridal packages, I was like, what is that? What is that? We don't have those in New York. What's a bridal package? It's so confusing. And then I had to research what bridal packages were. And I was like, whoa. And I was like, I don't do that.
What does the bride want?
Your skin. I can make you look good. Can we talk about that? It's so confusing. But actually, I wanted to ask the doctors here a question. Did you guys see this, that after the second wave, that people aged really fast? I felt younger people, they showed the signs of aging much more than they did even a few years ago. Was it just me that noticed this?
No, I think I have also noticed that. And I was trying to figure, what was it? The stress? Was it extra screen time? Was it just going, ballistic in terms of your food because you're at home all day long and you're eating, not right or whatever, or binging or whatever? But or is it people who have had COVID and has there really been some change in the hormones or whatever? But yes, I agree with you. I mean, these could be the different reasons, and I do agree with you. I have seen people
especially with the under eye area, the kind of effect it has had. And also because of the vaccine, a lot of hormonal disturbances has happened, be it with their PCOD or thyroid, and that does affect the skin. Yes. So hair fall, under eye area, loss of collagen in the skin, definitely it's there. And stresses, even if one person in the family is sick, it does cause stress to everyone.
Yeah. No, there have been a lot of things, in terms of stress. I mean, loss of jobs or pay cuts and, or just sitting at home. Sometimes gets onto, it gets onto us, it got onto all of us. So I think stress played a major role.
Yeah. So much pain, so much suffering. It was a lot for people. Yeah. It shows on the skin.
So I think, smoking, a lot of alcohol will cause puffy eyes. And so I think late nights, break down your collagen, get you, your wrinkles, out there. I think maybe that's the reason.
Actually, I would love for Dr. Kiran to tell me how important consistency is when you go for these injectable moisturizers, fillers, everything that we spoke about, because at the end of the day, they are short-term results and not long-term. So how can one keep up with it?
Okay, that's a great question, Sanjana. So this is how I view it. When it comes to skin boosters, and when it comes to injectables, look, people always say, do I have to keep doing them? You don't have to keep doing them. It's not mandatory. You're not going to get addicted. You want to do them this month and 3 months later, you're like, man, I don't really want to do them. That's absolutely fine. However, that being said, when it comes to consistency, when it comes to things like skin boosters, if you do them every year, you will find your skin gets younger, more fresher, more elastic. It has a long-term benefit. So you will find more collagen and elastin production. When it comes to Botox, when you do it regularly, ideally, if it's done correctly, then the formation of lines should reduce. When you do your fillers regularly, then the result that you want keeps happening. But if you don't want it, then you don't have to, right? The best part about fillers and Botox is you can actually change. It might be this year you want one lip, and maybe next year you want a more subtle lip. And maybe this year you want your eyebrows a bit more arched. Maybe next year you want your eyebrows a little bit more rounded. So there is that fun when it comes to Botox and fillers that I can have the look within a tweaking sort of range for that set period of time, and you don't have to continue. But when it comes to skin boosters, consistency is needed. When it comes to things like laser treatments or micro needling to really keep boosting that collagen and improving your skin, consistency is needed. We can't just start and stop willy-nilly. We must have a program. And good skincare is required. But look, I'm also not a believer that you need to live in my clinic or anyone's clinic every day, once a month. Once your skin is at the point that you want it, once in 3 to 6 months, check in. We're not your number one place to go to for every day. Although we are your number one place to go to. That's a separate thing. But we don't want you with us all the time. Life goes on. We all have lots of things to do. You can have great skin and not invest enormous amounts of time in it, but you do have to be consistent.
Right.
Yeah.
Right.
I would add to that one little thing that, when Kiran spoke about fillers and, the next year, if you don't want to do fillers, you don't need to do fillers. A very common question people ask is that, am I going to age more if I stop doing it? Is my skin going to look worse when I stop doing it? No. This is hyaluronic acid. It boosts your collagen. So I always tell them that, even if you stop and your skin sort of comes back to whatever, it will never come back to square one. You will always be better than what you were when you started. You will not get worse. So that's something you need to understand.
That's absolutely correct. Yeah, great point.
Okay. Yeah, because I think that's always a constant worry. What if I can't keep up? So it really, really helps. Dr. Geetika, I would love to hear from you. Now, someone's gotten a treatment done. What are the immediate practices to be followed to get the most out of the treatment?
So it depends, first of all, what treatment are we talking about? There is a whole lot, as we have understood now. There can be injectable skin boosters, there can be Botox, fillers, lasers, microneedling, and whichever treatment that was done, and to get the best out of it is to have a good skincare routine at home, because that cannot be substituted. As I said, these treatments are meant for people who have their bases right. The bases right is a good skincare regime, the cleanser, the vitamin C, sunblock, retinol at night, maybe not every night, depending on how and where are you on that level. And then your vitamins, your supplements, your sleep, your intake of alcohol, smoking, your food habits. So to get the best out of the result, this is important, because if a dry skin is there and if that has got a skin boost and you're still not having enough water or doing the right kind of skincare regime, it will go back to it. You can get the most out of it by doing it properly. So That's important. You cannot have a shortcut to a good skin. I believe skin is the largest organ of the body, and to do anything with skin is beauty inside out. Everything has to be done at the right places. Check mark to all the boxes. Not one thing can take over.
I completely agree. It is the skincare routine that is the base of all things good. Just adding to also what you said, Dr. Geetika, you mentioned how it's so important to have a concise routine and make sure you're at it. Now, the pandemic also has seen like a lot of people playing with a lot of facial tools at home, right? There are ice globes, jade rollers, gua shas that are happening. How important is it to have these tools as a part of your skincare routine?
I gave them some tools myself. So it's more for relaxation. A gua sha or a jade roller will not substitute, say, an L-therapy or a Thermage or a Botox and fillers. They are just for relaxation and to spend more time with your skin. And doing it correctly is important, which Dr. Jaishree also pointed out. Say, I saw the other day some of the girls teaching the spatial yoga exercise where she was very aggressively pulling on the skin and there were lines all over here and skin going like this. That is so wrong. So you have to learn the right way to do it. Even while you're using a gua sha, I saw so many of the girls doing it the wrong way. You're holding it right at 90 degrees, which is putting so much pressure. It has to touch your skin and you have to just lather it on. You have to clean it. Sanitization is very important. So all these things have to be done. And you can't replace a good skin treatment or a treatment with these tools. These tools are a great way to improve the lymphatic drainage. If you have puffiness on the skin, I'm a hypothyroid patient and I get puffy very easily. So they're a great way to just remove that lymphatic drainage from the puffiness, the water retention on the face, to relax with a nice facial oil once in a while. That's it. I don't expect magic from these tools.
So Sanjana, actually, I also talk about this. I talk about tools in my book as well, which is similar. I like gua sha. I think it's great for lymphatic drainage. How you do it is important. I'm not the biggest fan of facial massage overall, because especially if you're acne prone, the kind of acne you can get from facial massage is alarming. Yes. Also, the wrong oil can really look. You know what? At the end of the day, we all have this concept about natural, right? Oh, it's natural, therefore it must be safe. Oh, it's natural, therefore it can't cause any problems. I have seen actually more side effects from natural things than from the things that we've studied, understood, researched, have seen. What are the side effects? What are the positives? You know, we actually have measured information about this, whereas there's no measured information about some huge mix of essential oils, which someone has massaged their face with for 20 minutes every day and then developed severe cystic acne. Treating that cystic acne is way harder than actually using a great product, like a nice topical retinoid to treat your acne or prevent your acne. We have to be really careful. And it's actually something that I talk about a lot and I write about also. That just because it's natural doesn't mean it's safe. We have to look at safety. We cannot look at, oh, it's natural. What is safe?
That, Kiran. In fact, I'm sure you also see a lot of patients who use coconut oil all the time on their face. I love coconut oil myself, but just to clean, wipe off or wash off your face. Don't leave it on your face. It's comedogenic and they don't have the knowledge. They would even use coconut oil and go out and sit in the sun. You're baking yourself. So it's very important to have the basics right and not start using all these things just because they're natural. They might not be meant for you and they have to be done correctly.
No, I had a patient that gave herself like a full photosensitive rash because she used lemon on her face. And
I was just going to say that. Oh my God, lemon is like detrimental, and the amount of, the number of people who actually use lemon on their face is insane. Every other person you ask in the clinic, they are happily using lemon, saying, oh, our blemishes go away and the skin. I can see Sanjana's eyes rolling. Are you also using lemon on the face, Sanjana?
No, absolutely not. Just the thought of it, like how people do this.
Yeah. And tomato slices, tomato slices on a dry, flaky face, causing so much of irritation and post-inflammatory hyperpigmentation. It's quite insane. So, Kiran, I so agree with you. Not everything natural is safe, and that's something that people really need
adding to the list, cinnamon powder.
I was just going to say that. Cinnamon. Yeah. It causes so much acne. My God. Oh.
And even sugar scrubs. People are using sugar scrubs for their face. The particle is so big. It's so aggressive. It can give you abrasions on the face. And people who have dry skin, they're all the more using multani mitti and all those clay packs, which is further making their skin dry. And they think it's all natural. So there is science behind these natural products also. They have active ingredients. And that's where the knowledge is important to put the right thing on the face.
I would love to know from all of you, what are the top 2 skincare trends that are going to be big for the whole of 2022? We'll start with skin boosters and one more, Dr. Jaishree.
So I think the fox eye trend is picking up. People are loving it. So I think that's also going to be something that people look at. But the trend is going to be no makeup, natural look. That's what people will ultimately aim at.
More focus on skincare overall, like you said, holistically.
Yes.
Dr. Kiran, what about you? The two top trends for 2022.
So I actually think so this sounds really technical, but I actually think transdermal delivery of actives is going to be huge, which is, those pimple patches and those they have those really cool patches you can use around your eye that actually has tiny microneedles, which they input those little actives in. So it really improves the deposition into the skin. I think those are going to be popular, although I think they'll have quite a few side effects. So I don't know how effective they'll be. I do, obviously, everyone knows my obsession with skin boosters. They are my favorite. They're just so good. But I think a very natural, the whole concept of Tweakments will be infinitely more popular with a combination of threads, a bit of Botox, a bit of filler, a bit of skin boosters. It's combining therapies and making a look. It's about results now. It's like, look, I want to look a certain way, and I want to look like a better, like a more refreshed, healthier, happier version of myself. Yeah. So how do I do that? And I think that awareness is there. I think people are ready. And I think people also know that it's relatively safe and comfortable. And as Dr. Jaishree said, it's lunchtime. I think that's big. And I think people are ready to, start taking the plunge and doing what works, as opposed to just being scared. We've lived through enough fear. It's time to move past it.
Right. Now, on to you, Dr. Geetika. Top 2 trends.
I love the way Kiran had said soft, happy looks. That's what we want to create, and that's what everyone wants. And adding to the list, of course, I agree with all these trends. Skin boosters, favorite number 1. Fox eye looks, yes, a lot of people have been asking about it. We are doing some of them, and there are people who really want to have those beautiful, sexy fox eyes. And then new skincare products are coming in, which are effective. People are getting more educated. But adding on to that, they're also looking at wellness, which I was talking about initially. People are just not looking at skincare from top of it. They're also talking about wellness quite a lot. So the trends would be more talking about the inside cleansing, detoxifying, maybe with colon hydrotherapies, with oxygen chambers, because now aesthetics and wellness is coming to meet each other somewhere in the middle. And then body sculpting also comes as a very important part. People are not just wanting to do the fat lysis or cool sculpting as it is. There are also people who are really fit and they want to build up their muscles. So technologies are getting more and more advanced to give them that muscle mass. So there are beautiful technologies which are getting launched. They work on your muscles to give you those bubble butt or the abs that you have been wanting to create in just a matter of few minutes. Like in 30 minutes, these new technologies can give you contractions, which are like 20,000 to 30,000 contractions. So imagine the kind of results you can get them. And they're evidence-based. You can study them with ultrasound. You can see the results for yourself. So I think technologies are getting more and more evolved. And the satiation to look good is not still satiated. So people want to look good, feel good inside out.
I agree. It's all inside out. Now, last question. We're on to our last bit. I want all of you to leave the readers with something on the whole discussion we had on Tweakments. So I'm going to start with Dr. Jaishree, something you would tell the readers.
Yeah, so I think people should respect their skin. That's really important. And make sure you do not treat it casually and don't just read things on the internet and start treating your skin. Please consult with a dermatologist. And please remember that skincare is holistic and your skin stays with you for your lifetime. So you need to take care of it, right? It's lifetime maintenance. Tweakments are an absolute necessity of the day. You need to look young, refreshed, confident, and happy, right? So that's very important. And don't shy away from them. Don't feel scared. Just you must make sure you go to the right place. That is important. The right place, the right doctor, and just stay positive.
Thank you, Dr. Jaishree. Something you would like to say, Dr. Kiran?
Yeah, look, like I say, fear is the mind killer. I don't know how many people watched the movie Dune or read Dune. I grew up on Dune. Look, the point is that there is actually nothing to be scared of. We're here to help. We want you to look good. We don't want anything bad to happen to anybody. We want people to have the best results. We want them to feel beautiful, and we want them to feel beautiful from the inside out. We want them to eat well, live well, exercise, feel good when they look in the mirror. We want them to be happy, right? My job is to make you happy. And we're here to help you do that. So throw away the fear, figure out what you're interested in, be armed with information about it so that way you can ask the relevant questions. We're here to answer them. And then walk out knowing that you've taken what you want in your own hands and you have control over it. And you can move forward and you can achieve what you're looking to for your own self, and you can feel good about that.
That was lovely. Thank you, Dr. Kiran. Now, Dr. Geetika, something you would want to say to the readers?
How sweetly everyone has put it forward. I'm just trying to find the right words. I feel this is the time, and I've seen that shift also happen. Women taking the ownership of their beauty, how they want to feel and they look, and you have every right to look and feel good at all point of times. There is no right age, no time limit. There is no barrier for you to decide that, oh, I'll be of a certain age and then I will do this for myself, that for myself. The time starts now. And whatever you do, it starts from within, which is maybe getting a beauty sleep, going for some exercise in the morning, planning your meals ahead, choosing well to eat, planning your doctor appointments, going for the right treatments, and choosing your look. Sit with your doctor, understand the kind of a personality you are and what kind of look you wish to achieve. You just have to be the better version of yourself. You don't want to look like other people. So understand what is it that you want. Do you want to accentuate your features, or do you just want to maintain something? So look at all of these and start making decisions for yourself. I think that's a shift that women need to bring amongst themselves, waiting for the right time. The time is now. Take the ownership, and we are all here to help you with the right knowledge and the expertise.
There's one more thing I want to add here, that please do not be obsessive about anything when it comes to skincare and treatments. So, there is a thin line which you may cross, and, that's why you have doctors who will help you understand that you should not be crossing that line. So, body dysmorphic disorders is a condition where people just go overboard and stuff their faces and just want treatments, and they always find faults in their faces. I think it's very important to embrace the color of your skin and to embrace your face the way it is, and look at those subtle changes which will make you look happy, as Dr. Kiran said, and refreshed.
Right.
It's about fear, right? When you're getting obsessive, all these people are just scared. They're terrified that they're not going to look a certain way, and then, that you won't be loved or liked. And I think that's important to really understand that no matter what you look like, you'll still be loved. Yeah, that you'll still be liked, and there's no reason, if you have a few pimples or you have a few problems, there's no reason not to like yourself or love yourself. By all means, you must. Yeah, and then that stuff we can help you with. It's
easy. Let's not put so much pressure on the skin. Skin is easy. Let's just make the right easy. And Dr. Jaishree, to add to the body dysmorphic disorder, I think a lot of onus lies in us as doctors also, to make our patients have this journey well undertaken easily and smoothly.
Exactly. That's what I said. Go to the right doctor. Yeah.
I mean, that's why I said patients shopping from doctor to doctor, doing procedures after procedures. I myself tell them, sit them down, that listen, so much has been done, and I don't think so more should be done. So it's very important, and I really take pride in saying no. And I feel the journey starts within first. Embrace yourself.
It starts with us. Absolutely agree with you, which is why I said choose your right place and right doctor. That's so very important. Another important thing that just struck me is that please do not look at those Instagram pictures of everybody. There are tons of filters, and there is also distortion when you do selfies. So do not gauge depending upon all these social media pictures that are put up. So that's also very important.
Everyone looks really different in person than on Instagram. I just want to put that out there.
They're like two people, for digital life and for your real life. But that was absolutely lovely. We are going to end the session with, all three of you said, it's all about embracing yourself, and it starts from within. And I love ending the session on this note. Thank you so much, Dr. Jaishree, Dr. Kiran, and Dr. Geetika, for agreeing to be a part of this and for taking the time out to do this. It was an absolute pleasure to have you guys for today.
Thank you, Sanjana.
Thank you.